Hello everyone, I'm Suzi Armitage. I'm the designated doctor for child death for Leicester, Leicestershire and Rutland, which rates among one of the worst job titles, I think. But I work alongside the Child Death Overview panel, carrying out the statutory child death reviews. And one of our sort of ongoing learning themes is around safer sleeping. So this is a talk about safer sleeping for babies in LLR and how we can help families to ensure their babies are sleeping safely. As a bit of a trigger warning, obviously it does cover the topic of infant death, and if that's something that is a bit tricky for you at the moment, feel free please to dip out, and we should be done by 10 o'clock, just to mention that. So the purpose of child death reviews is to look at why children die, to look to see if we can identify any contributory factors, whether any of those might be modifiable, so we can do something about them to prevent future child deaths. And we try and capture learning, share that learning, and pick up any actions we need to take from cases. We look at all child deaths of any child of any gestation up to the age of 17 years, 364 days resident in LLR. So next slide, please. So we work looking at child deaths that are expected. We also look at child deaths which are unexpected. And in those cases, we carry out something called a joint agency response. And we follow guidance issued by the Royal College of Pathologists and Royal College of Paediatrics and Child Health to look in a multi-agency way to try and understand why a child has died. And this is a quote from the guidance, and I think this kind of sort of sets the tone for everything that follows, that whenever an infant dies, it is a tragedy, first and foremost for the infant and the family, but also for all those who knew the infant and family, including those professionals who may have worked with them, and for society as a whole. Next slide, please. So in terms of sudden infant deaths, we know that the number of babies dying unexpectedly has fallen markedly over the last 30 years. And a lot of that is due to work carried out by Professor Pete Fleming and others, understanding that positioning of babies to sleep is really important, and the Back to Sleep campaign that came in. And that caused a dramatic drop in the number of babies dying unexpectedly and with no clear explanation for their death. And you can see from the chart how the numbers have fallen over time. Across England and Wales in 2020, there were still 150 babies who died, and in spite of extensive investigation, which would include a full post-mortem examination, the cause of their deaths remain unexplained. What we do know is that safer sleep practices can reduce the risk of sudden infant death syndrome and can also reduce the risk of accidental suffocation of infants during sleep. So in terms of what those numbers mean for us locally, we review on average around 70 cases per year. And when we looked at our data from 2016 through to 2022, we noted that we recorded an unsafe sleeping as a modifiable factor in 16 infant deaths. So that's where unsafe sleeping was felt to have contributed, not necessarily caused, but contributed to the death of a baby. That unsafe sleeping was potentially modifiable. There's something we could do differently in future, which might prevent this occurring for other children. And in 10 of these 16 cases, we noted.
You've muted yourself, Susan.
Sorry, I was trying to. Okay. So in 10 of this.
Susan, you've muted yourself again.
I think it's other people muting all.
Someone is muting me.
Yeah.
It's muted again.
You're on mute again, Susan. Sorry.
It's not me. Someone is muting me. Sorry. Can you hear me now? Right.
Yeah.
Okay. So I don't know how much of the last bit you had. We looked at 16, so we identified 16 cases over 6 years where unsafe sleeping was thought to be a modifiable factor, and unsafe co-sleeping in particular was something we picked up. Next slide, please. So in terms of risk from unsafe sleeping, we know that there are certain things that raise the risk for babies, and that they are more at risk of sudden unexplained death. We know that unsafe sleeping positions increase your risk, so that's where the Back to Sleep campaign was key in making sure that babies are put on their backs to sleep and not on their sides or their front. We know that if parents smoke, that can increase the risk. We know that if the sleep environment is unsafe, that can increase the risk. And we're talking about unsafe co-sleeping, so not co-sleeping per se, but co-sleeping with additional risk factors, which is known to be unsafe. But if babies are overwrapped and too warm, that can increase the risk. If babies are sleeping on very soft sleep surfaces, that increases the risk. If there is parental alcohol or drug use, particularly around the time of co-sleeping, which would constitute unsafe co-sleeping, but also in terms of background risk factors, we know that those babies seem to be at increased risk. If there's a history of poor antenatal attendance or late booking, or if a baby was born preterm, so before 37 weeks gestation, or if there were low birth weight, so that's less than 2.5 kilos, those babies are also at increased risk. There are certain things that have been identified in the literature that reduce the risk and make things safer. So room sharing when sleeping with parents or carers for the first 6 months is known to reduce the risk. Breastfeeding is known to reduce the risk. Dummy use during sleep is known to reduce the risk, and babies who are immunised, fully immunised, they seem to be at a reduced risk. So none of these things cause SIDS, cause these unexplained deaths, but they are associations, and we see that pattern there in the research. Next slide, please. So you can also look at these risk factors in a slightly different way, which might be more familiar to some people, using this sort of common assessment framework and thinking about those factors in terms of parenting capacity, in terms of the family and environment, and in terms of the child themselves that could potentially raise the risk for a baby. And as you can see, there are risk factors there that we know increase the risk of harm and poor outcomes for children, not just in relation to risk of sudden death, but for a whole host of other adverse outcomes as well. Next slide, please. So the advice is, and has been for some time, that the safest place to sleep for a baby is on their back, feet to foot, so their feet down the bottom of the cot or Moses basket with blankets tucked in, on their back, feet to foot in a cot or Moses basket in the same room as a parent or carer for the first 6 months. So that is the advice that is being given. That is fully evidence-based, and we know that that is the safest place for babies to sleep. Helen, if you could click. However, we know that babies don't read the rule books. Babies sleep here, there and everywhere. We know that family life is complex, and actually trying to follow that guidance to the letter, if you have more than one child, let alone any other sort of vulnerabilities or challenges, is really difficult. And we also know that lots of things influence parent and carer decision making, and not just the advice that health professionals or others give, but there are lots of things that impact on what parents choose to do and how they choose to put their baby down to sleep. Next slide, please. So the Lullaby Trust have developed something called the ABC of Safe Sleep, which is more generic and enables parents to sort of apply the principles to wherever they are and wherever their baby is sleeping. And these are really helpful, sort of memorable things that we can be talking to parents about. So it's really important that you always sleep your baby on their back in a clear cot or sleep space. And it moves away from the Moses basket thing. A lot of babies outgrow their Moses basket by the time they're about 8 weeks old, I think. So it's talking about sleep spaces, and it's always, so it's every sleep, not just the nighttime sleeps, but the daytime sleeps as well. And these are the principles to follow for safer sleep. Next slide, please. These are just a couple of images just to highlight that for parents these days, there is so much out there on Instagram, Facebook, TikTok, wherever, these beautiful images of these lovely little curled up snuggly babies, and it all looks very beautiful and pretty. And there is an awful lot out there that promotes a beautiful environment, but that is actually unsafe for sleeping. So it's just being aware of the sort of messages that parents get in their sort of everyday lives, and that sort of saturates their social media experience as well. So we're kind of having to sort of challenge some of that and push back against some of that. Next slide, please. So in terms of evidence-based guidance, this is what health professionals are advised to say to parents. This is the NICE guidance on postnatal care. And it's really important that we're discussing safer practices for bed sharing. So we're no longer saying don't co-sleep. We want to have open conversations with families, acknowledging that some families will choose to co-sleep, and acknowledging that in a lot of cultures around the world it's completely normal practice to co-sleep. And we know that co-sleeping in and of itself does not increase the risk, but it's about doing it safely, and that there are other factors that can come into play that increase the risk and actually make that unsafe. So discussing safer practices for bed sharing, so making sure that the baby is on their back on a firm flat mattress. Really important that parents are advised never to sleep on a sofa or chair with their baby. This increases the risk of sudden death by 50 times. It's really risky, and it's really important parents know this. Not to have any pillows or duvets near the baby, and not to have any other children or pets in the bed with when sharing with a baby. Next click. And it's important to strongly advise parents not to share a bed with their baby if their baby was low birth weight. So regardless of gestation, if they were under 2.5 kilos when they were born, it's really important parents are advised not to share a bed with their baby if they've had 2 or more units of alcohol. It's a bit like drink driving. The advice is generally, if you've had a drink, don't drive. It's the same with co-sleeping, but certainly more than 2 units of alcohol, it's not safe. If either parent is a smoker, and that's regardless of where the parent smokes, whether it's in the house, outside the house, we know parents will say to us that they smoke outside, and yet we see evidence, unfortunately, on babies who've died that they have been exposed to cigarette smoke. So if either parent smokes, they should be strongly advised not to share a bed with their baby. If either parent has taken medicine, prescription medicine, or over-the-counter medicine that causes drowsiness, or if either parent has used recreational drugs. Next slide, please. Oh, Helen, are you able to move to the next slide?
I have put the next slide on.
Okay.
Safer sleeping and the law.
I shall carry on talking, and then the slides can catch up with us. That's fine. So yes, it's also important to note in terms of the law that that it is actually a criminal offence so the law is that if anyone 16 years or over co-sleeps with a child under the age of 3 years on any surface whilst under the influence of drink or alcohol and causes their death by suffocation, they could be liable to criminal prosecution. And if anyone of any age co-sleeps with a child of any age on any surface whilst under the influence of any drugs, substances or alcohol and causes his or her death by suffocation, they could also be liable to criminal prosecution. So not a lot of people realise that there are some laws around this as well. How those laws are interpreted in practice, there are lots of decisions and things that go into that on a practical level, but that is what the law says. So next slide, please. So we've talked about some of those things that increase the risk for babies. There is one other key thing that has been found to increase the risk for babies, and particularly those babies who are vulnerable, but not just those babies, for all children, all babies. In 2020, the National Safeguarding Panel carried out a review of sudden unexpected death in infancy in families where children were considered at risk of significant harm. So they looked at 40 cases of sudden deaths in infancy and babies who were on child protection plans to look to see whether there were any particular factors or any learning that could come out of that to help us protect these particularly vulnerable babies. And as we've noted before, there are many risk factors for sudden unexpected death in infancy that overlap with those for child abuse and neglect. And what they saw was that there are families where we know there are some predisposing risks or predisposing vulnerabilities. So all those things that we looked at in the triangle, those risk factors that were there. And then on top of that, there were situational risks that happened or out of routine events. So these are families that were out of their usual routine and some kind of critical incident happened, and then the baby was found unexpectedly deceased. So these are families who are typically living in the context of recognised background risks, so people knew about the risks in the families, but they've had some disruptions to their normal routine, which meant that they were unable to engage effectively with safer sleeping advice. And that included families, for example, who were fleeing domestic violence and staying in a sort of temporary accommodation setting and sort of making do in a very temporary way. Also families who had friends come to stay and were sleeping sort of all over the place in the house in different places to accommodate other people staying, and the routine was different, and what they would usually do for their baby to keep them safe had changed and they did something different. So it's so for families being out of routine, that's something that is kind of being talked about more as a potential risk factor. Next slide please. So in terms of recognising and responding to these risks, it's really important for all babies sort of universally that we're thinking about prevention and how to help families engage with safer sleeping, and it's really important that it's a sort of conversation-based approach. It's not just a list of do's and don'ts. We know that decision making is really complex, and if there are particular barriers for parents being able to follow the advice, it's really important to explore those. When we're talking to families, it's really important they understand the link between the advice we're giving and why we're giving it. So it's really important not to co-sleep with your baby on a sofa, because if you fall asleep with them there, they might get trapped between you and the side of the sofa, and there's potential for accidental suffocation. So talking through and explaining the mechanisms to help families understand, because then they can use that information and apply it to other circumstances. It's really important we're empowering families with the knowledge of the risks so they can assess their own risks for their own particular baby in their own circumstances, and then they can develop their own plans, and supporting families to develop their own plan for safety at every sleep. And that might include thinking through, you know, if we were going away for a night, what would we do? If I was going out for a drink with some friends and came back, what would I do to make sure that I don't end up with a baby sleeping in bed with me? Wherever I got to put them, how am I going to plan for these things? And it's really important for these vulnerable babies that we know where there are lots of these sort of background risks, that we're taking steps and thinking more about protection than prevention. Early recognition of and response to these vulnerability factors is key. We know the most vulnerable time for babies is in the first sort of 3 to 4 months of life, and for a lot of families, professionals might just be getting to know them. They might not be known to lots of agencies. So if there's those factors are there, it's really important to sort of recognise those and try and respond to them early on. It's important to think about safer sleeping as part of that broader assessment of risk, and safer sleeping is included within the LLR neglect toolkit, and to think about safer sleeping when we're thinking about safety planning, you know, if particularly if there are limitations on housing or access to appropriate equipment, space, whatever it is, that we're thinking about safer sleeping as part of that safety planning, and including in families where there is known alcohol use, substance misuse as well in either parent. Next slide, please.
Oh, hello, Kerry. Are you all right?
Oh, I think someone's not on mute. Okay. So it's really key. Safer sleeping, I think, is one of these things. We think, well, this is something that the health visitors or the midwives talk to families about. It's really important that we're all talking about it, because lots of us come across families with little babies in various different scenarios. Okay. So it's really important that for every baby we're having those curious conversations with families, exploring a bit about where do they put their baby to sleep, are they aware of the advice, are they able to follow it, that they're engaged in sleep practices for every sleep, that if there are times where they're going to be out of routine, if it's family events, nights out, if the baby's unwell, if there's an emergency situation, you know, have they got sort of strategies and things they can use? Can they apply the advice even in those situations? It's really important the messaging is consistent. Families always say it's, you know, they get really confused if people come to them saying one thing and the GP says something else, and what do they do? So consistent messaging, and thinking about the wider family, so not just mums, but partners, grandparents, those wider family networks, and not just with the first baby, but with each baby, reiterating that advice, because the sort of environment, family practices, routines change as each new baby comes along, and thinking about embedding support, for embedding safer sleeping and support for those broader family risks and vulnerabilities. We know if we support families in these areas, that reduces the risk of sudden death. It also reduces the risk of other adverse outcomes as well. Breastfeeding promotion, supporting all household members with stopping smoking, cutting down on smoking. If there are housing issues, if it's a case of physical space, that there isn't actually space for the baby to sleep anywhere other than in the parent's bed, you know, thinking about these sorts of things. If a family is known to your service for alcohol use, substance misuse, thinking about that safer sleeping advice, and how you can sort of feed into that for families. And again, families who are struggling with mental health needs or domestic abuse, again, thinking through all those recognised sort of opportunities to reiterate the messaging and recognising the particular risks that those vulnerabilities might pose. Next slide, please. Oh, that was backwards, I think. Thank you. So in terms of where to go to find out more, there is absolutely loads of really high quality information on the Lullaby Trust website. There is lots on there for families. They have easy read information if you have a family you're working with who have functional illiteracy. If you have families whose first language isn't English, they have information in a multitude of languages about safer sleeping. And for professionals, there is lots of information on there, lots of resources, including, if you're interested, the full evidence base behind the advice as well. And there's lots of all those questions families ask that you kind of think, oh, I don't quite know. Baby sleeping in a sling, or car seats, or pods, or nests, all these kind of things. It's all in there. So it's a great resource for everyone to use. Birmingham have developed some resources around alcohol consumption and parenting supervision, not just for babies, but for children as well. They're just short videos that just get the message across to families about thinking, you know, if they've had alcohol, who's looking after the baby, how are we making sure they're safe. There's a fantastic resource aimed more at dads called Lift the Baby, safer sleep advice for dads, and they've got a website as well. The NICE guidance is available online for anyone to look at, and that's what healthcare professionals are engaging families with. If you're working with a family who don't have access to the right equipment to help their baby sleep safely, Baby Basics is a fantastic local charity. You can refer families into there. They provide pre-loved Moses baskets and cots, all safety checked. They have new mattresses that come with them, and all the other equipment that families might need. And as I mentioned, that safer sleeping is included within the LLR neglect toolkit, and that's available online as well through the LLR procedures website. So that brings me to the end of my talk. So I think I'm run over by a few minutes. If there are questions, unfortunately I need to leave now for another meeting, but if anyone has questions, please feel free to send them in, and I'm sure they'll wend their way through to me, and I can more than happy to respond to those. So thank you.